Hey everyone, it's Christina Richardson, the celiac disease dietitian, and today I'm going to be covering a very important topic, and that's how to monitor your child or children for signs of celiac disease, especially if celiac disease is already known to be in the family. Okay, so as you may already know, when someone in your family is first diagnosed with celiac disease, it's recommended that their close family members get screened as well. So that includes parents, children, brothers and sisters that are related by blood. Now, assuming that everyone is eating plenty of gluten at the time and they have their blood test and it's negative, then that's great. However, you do have to keep in mind that one negative blood test is not necessarily the end of the matter, and this is especially so for children. And that's because it's quite likely that most people who end up finding out they have celiac disease later in life probably developed it when they were a child. And that's unfortunate because I've heard some terrible stories over the years from people who've experienced all sorts of health issues over their lifetime when they could have been diagnosed with celiac disease as a child. But things are starting to change nowadays and more children are getting tested for celiac disease, which is great. Because the research tells us that diagnosis early in life not only leads to better health outcomes, but kids who are diagnosed when they're quite young also tend to report less mental health issues and better overall quality of life than people who were diagnosed when they were older. So that's why it's important to keep an eye on our kids for signs of celiac disease, especially if celiac disease is already in the family. Now, we don't want to be overly anxious about all this, but I do think it's really helpful to know some of the potential signs that could indicate celiac disease and some red flags which would indicate they need to get tested ASAP. Now, the current recommendations are that kids who have a first-degree relative diagnosed with celiac disease, so that means a parent or a sibling, should get screened for celiac disease around every 2 to 3 years, even if they aren't outwardly showing any symptoms. This is because even without obvious symptoms of celiac disease, there can be detrimental effects on a child's development if they're not absorbing their nutrients properly. After childhood, you would then just move to testing if you start developing symptoms or get low in iron and things like that. But that's a whole nother video. But anyway, the 2 to 3 year screening rule only really applies if your child hasn't developed any symptoms or issues in between. So this is where I'll start to cover the answer to your burning question. What are those symptoms or issues that might arise that I should be looking for? Well, it's quite helpful to keep in mind here that the presentation of celiac disease, so how it shows up, does seem to follow a bit of a pattern according to age. In general, the younger you are, the more celiac disease will follow the classic celiac disease presentation with things like diarrhea and weight loss and issues with growth. Then gradually, the longer you go undiagnosed, the more things start to change to the more atypical or unusual things that aren't gastrointestinal in nature. So in a general sense, and again, not everyone will fit this pattern, but babies and infants with celiac disease will tend to present with quite severe gastrointestinal symptoms, so things like vomiting, reflux, persistent diarrhea. Now, any of those things in a baby should be checked out, but if they experience failure to thrive, which is the medical term for not growing or faltering in their growth, that's a red flag and needs to be investigated immediately. With toddlers and kindergarten-aged children, symptoms can include all of the above. They might also start having constipation or telling you they have tummy pains. They may have quite a distended tummy, even when they haven't just eaten. They might be always covered in bruises from climbing. You might start to see some of the behavioural signs of celiac disease, things like irritability, tantrums and mood swings. And I know what you're thinking, that's just normal for that age. But as a parent, and especially the primary caregiver, you will know and you'll need to trust your gut if it's telling you that something's not right, okay? So if your child is clearly extremely unhappy and exhibiting extreme behaviour that doesn't really fit in with the norm for them, get them checked out, okay? Don't listen to other people or even a doctor telling you it's normal for that age. Push for a test of their iron and their celiac antibodies. Okay, so now we're getting to school-aged children, and the signs you're generally on the lookout for here can still be all of the above. So tummy pains, diarrhea or constipation. They may even seem to have trouble with toileting, like not making it to the toilet in time for a poo, randomly vomiting or feeling sick after eating, having lots of aversions to foods because they make them feel sick, changes in behaviour, Also tiredness or being lethargic all the time. Okay, that's not normal for kids, no matter how much they've been running around all day. Children can also start to complain of pain in their bones or their muscles, which can be a sign of vitamin D deficiency. They might have poor immunity, catching everything that goes around. With their teeth, when their adult teeth come through, they might have defects in the enamel, making them overly yellow or patchy looking. And again, if they stop growing or slow down in growing, that's a red flag. And I'll talk more about how to track growth at the end. But yeah, if growing slows down, that's something that needs to be checked ASAP. Another one is if they break a bone and you think, it really didn't seem like it was enough impact to cause a breakage, that's another reason to screen for celiac disease. So once you get to high school age children, the symptoms of celiac disease can start to get a little more weird and wonderful and complex. So there might still be any of the symptoms I've mentioned already, including gastrointestinal symptoms, but by now, especially if they've gone undiagnosed for a while and those nutrients are really getting low, some more complex bodily systems are starting to be affected. So you can start to see things like loss of menstrual periods, or even delayed puberty, anxiety and depression, or even sometimes eating disorders can start to appear. They might also be just getting constant infections, things like chest infections, tonsillitis over and over again, even recurring thrush in older girls, and that's due to that impaired immune function that we often see in celiac disease. Okay, so now let me just state here that this is in no way an exhaustive list of celiac disease symptoms in children, nor does there even exist an exhaustive list, because celiac disease really can turn up in weird and wonderful ways, and every child is different. So I've tried to cover most of the common ones that I've seen through my practice and my experience and also my research over the years, but please keep in mind that any of these symptoms might overlap with each other. They might also come and go. Sometimes certain symptoms might happen for a few months, then stop and something else will take over. And that's just the nature of celiac disease and why it's so difficult to diagnose. But if there's anything that I haven't happened to mention that you have concerns about with your child, it's best to just get in touch with your GP. And again, trust your parental instinct and don't take no for an answer if you want them to be tested. Now, what I'd like to do now is just talk a little bit about one of the red flags I mentioned, and that's delayed growth, which can be one of the first and most obvious signs of celiac disease in kids. Now, notice I said growth and not weight, okay? So children with celiac disease will not necessarily be skinny. They may be normal weight or they may even be overweight. So it's by no means the only sign of celiac disease. But watching out for any delay in a child's growth is really important because it's a big sign that something's wrong. So this is why I always recommend that parents track their children's height and weight with growth charts. So if you go to the World Health Organization website, and I'll put the link in the description, you can find the relevant growth charts for your child's age. I recommend getting the weight for age, height for age, and also weight for height. Now, you may be familiar with growth charts already. All babies in Australia get a book, and your child health nurse or paediatrician will likely have started this growth tracking process for you. But after you stop seeing them, it's really up to you. If you've previously written down or somehow kept a record of your child's height, even if that's a pencil mark on the wall, then that's great. You can plot all that data in and start to see a pattern. So what you should do is track weekly, then monthly when they're babies. From age 2 to 5, you can track every 3 to 6 months, and then after that, you can just track them yearly or every 6 months if you have concerns. Now, generally, from a health professional's perspective, we wouldn't worry too much if only one point on this chart seemed to be a bit lower than the others, but if you see the line consistently dropping down, then that is a cause for concern. It's really important to be as accurate as possible with your measurements for this reason. We just don't want that line zigzagging all over the place with incorrect measurements. With my daughter, so she was tracking really nicely until around the age of 5 to 6 when she was diagnosed. And then after diagnosis and going on a gluten-free diet, she popped back up to her usual line, and that's what you want to see. Now, the final thing I want to mention in this video is that if you have strong suspicions that your child might be showing signs of developing celiac disease, but your doctor isn't very keen to get them tested because it's a blood test and it's considered invasive, then I just want to say, please don't go down the route of just trying a gluten-free diet, okay? So believe me, subjecting them to a 30-second needle is so much easier than later having to put them back on gluten for 6 weeks in order to get them properly diagnosed. I see so many people in this awful predicament, not really knowing whether their child has celiac disease or not. And what do you think is going to happen to that child when they reach their teenage years and think, I'm probably not even celiac, and then start being careless with their diet? So please, 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 if your child is having any of the symptoms I've described that can't be explained by anything else, like a tummy bug or, symptoms that just won't go away, and there is also celiac disease in the family already, just get them screened. You can usually find a blood collector somewhere nearby that has a lot of experience with kids. It's over really quickly and they get a certificate and sometimes a teddy bear, and it makes it all worth it. So that's it for me today. I'd really love to hear if your child had any of the symptoms I've mentioned, or even any symptoms I haven't mentioned. Before I go, if you like this video, please hit the like button, and even if you didn't like it, just hit the like button and subscribe to my channel. And if you'd like any help with the gluten-free diet, then you can visit me over on my Instagram or Facebook page and send me a message, and I'll let you know how I can help. That's it for today, and I'll talk to you soon.